Let's break down the formula D over H times Q for dosage calculations. It's simpler than it sounds. The formula is dose ordered, that's D, divided by dose on hand, that's H, multiplied by quantity available in, that's Q, D over H times Q. Dose ordered divided by dose on hand multiplied by quantity. Here's an example. Your patient needs 500 milligrams of a medication, but the tablets you have are 250 milligrams each. D is 500 milligrams. That's the dose ordered. H and Q are actually related to each other. Think about it like there's 250 milligrams in one tablet. So your on-hand dose is H equals 250 milligrams, and your quantity available, your Q, is one tablet. What's the formula again? D over H times Q. Now plug it into the formula. D is 500. Divide that by H, which is 250. 500 divided by 250 is 2. Now, quantity is 1 because there's 250 milligrams in one tablet. 500 divided by 250 equals 2. Multiply that by one tablet, and your answer is 2 tablets. This formula works for liquids too. You have an ordered dose of 10 milligrams, and the liquid comes in 5 milligrams per 1 milliliter. What's your D, H, and Q? Right. Your D is 10 milligrams, your H is 5 milligrams, and your Q is 1 milliliter. 10 milligrams divided by 5 milligrams is 2. Multiply that by 1 milliliter, and you get 2 milliliters. You'll note that the units of measure work out properly. The milligrams cancel each other out in the division, and all you have left are milliliters. 2 milliliters. Try one for yourself. The answer will be in the description of the video. A patient requires 200 milligrams of a liquid medication. The medication is available in a concentration of 100 milligrams per 5 milliliters. How many milliliters should be administered? Find your DH and Q, and it's simple. You got this. Yes, you can pass the pharmacology math section of your nursing licensure exam.